We're here for the preliminary impression, and let's just take a tour of the anatomy so we can see we got pretty nice healthy ridges, and one of the key landmarks that we want to point out is the hamular notch. So the way I like to do that is with the mirror handle. I'll go to the back of the ridge, and where I kind of feel it drop in is where I want the posterior extent of that denture to be, and we'll do the same on this side here. Okay. The other important landmark is a vibrating line. So I'll have the patient say ah, 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 ah. And the vibrating line represents the junction between the movable and immovable soft palate. Okay. So what I'll do here is start to mark the hamular notch. So I have an indelible marker here. So where my mirror drops in, I'll mark back there. Where my mirror drops back, I'll mark that and go ahead and say ah, ah, ah. So where I see it not moving is where I want to mark the vibrating line, and I want to connect those lines here. So that's as far back as I want the denture to go. So anything behind that line is the movable portion of the soft palate. This is the immovable. And I can palpate and see that there's some compressibility of that tissue there. And then you come forward a bit more, and that's the hard palate. You can also see the buccal and labial frenum, and we'll definitely want to make room for those areas in our final denture. So this is the technique I like to use to make the final impression. What I like to do is stand behind the patient, and I'll use either a finger or a mirror to retract. So we'll retract to one side, and I have the tray sideways, and I like to retract the cheek with sort of the front edge of that tray. So I'll do is when the impression material is here or loaded, I'll have it sideways, rotate it into the mouth, and then come forward here and lift the cheek up. So you see how my finger is rotated to the front? Now I can center the tray. So I'll look at laterally centered, and then anterior posteriorly centered. And then once I got it in the right position, then I can seat it all the way up. And right now I'll have the patient relax your lip, and with two fingers, with both hands, go and relax your lips here. And then you can pull the lip over and hold it in place, and then do some small border molding movements. Yeah, tell me to relax the lips a little bit and pull the lips out. Okay, so we'll evaluate this impression here, and we can see that we've captured the anatomy pretty nice here. That frenum that was pretty round, so you see it's captured in the impression, and you can see where we had marked the vibrating line. So at this point, once we pour it up into stone, the mark that will be transferred onto our preliminary cast, so that we know how far back to make that custom tray.